Here's why you should be coming to therapy on a weekly basis. So if you're attending therapy on a weekly basis or multiple times a week, good for you. This is so important because you're able to exercise your mind. You get your thoughts out, your emotions out, and you're able to continue to build that insight. This is so helpful. So individuals who are completing psychoanalytic or psychoanalysis treatment usually come in on a weekly basis, anywhere from 1 to 4 times a week. That's typical. And the reason being is because the insight that is built within session then can continue being built throughout the week. Now, approaches like cognitive behavioral therapy, CBT, tend to be more short in terms of the duration. So you might have something like 6 or 12 sessions, and this could be stretched out over a few months. So this approach doesn't necessarily mean that an individual like yourself needs to come in on a weekly basis. Usually because the main goal is to look at your thought processes, look at where there's problematic thinking, help restructure that thinking, and then build coping strategies. So insight is not the primary goal for CBT. But what ends up happening is individuals who come into therapy on a bi-weekly basis or a monthly basis don't get enough treatment. They are left hungry. So if you think about this, you're coming into session or you're coming into therapy for the first time and you're having an intake with a therapist and you've said, I've struggled with depression for most of my life, or I struggled with depression for the last year or 2 years. Think about what that means. Think about how many minutes, how many hours that were spent in that depression. So do you really think that 1 hour a month is really going to help you move forward and achieve your goals? No, that's not going to be the case. This is a defense mechanism. This keeps you stuck to ensure that you're not going to make progress. And that's upsetting, right? Of course that's upsetting and that's aggravating because you're investing in your mental health. So you want the very best and you want clarity in terms of what can actually happen. Coming in on a weekly basis, at the very least, allows for that insight to keep on building. So with the psychoanalytic approach, especially the patients that I see, I encourage them to come in on a weekly basis, if not more often, depending on their case. Individuals who are suffering from an eating disorder or addiction, I encourage them to come in at least twice a week, because without that level of exploration, the unconscious exploration, and we need to build upon the last session, then it's just going to be lost. And then if we wait 14 days or we wait 21 days or we wait a month, it's going to be very difficult for the mind to break down those defense mechanisms and to explore the unconscious mind. Again, it's not a direct approach, but if we don't explore the unconscious mind, then symptoms will keep occurring. So our behavior, at least according to the psychoanalytic approach, stems from our unconscious mind, not our conscious mind. So we think that, okay, we have a thought, I want to go get a drink, and I'm just going to go into the fridge and I'm going to get a bottle of water and I'm going to drink, right? But we also behave unconsciously as well. So for instance, someone who has experienced a difficult relationship, let's say with a parent, maybe with a father figure, then what ends up happening is that this father is internalized in the mind and can unconsciously be projected onto other people, such as maybe your boss. So as a result, you might act in such a way that is similar to how you would behave with your father, now with your boss. And this is what we call an unconscious enactment. And as a result, if we don't process the pain that you've experienced due to the relationship with your father, then we can't process what's going on between you and your boss, the dynamic between you and your boss. So as a result, we need to dive into the unconscious mind. We need to look more often at what is going on. We have so many thoughts a day. Majority of them are negative, because just by default, we tend to filter in the negative. It actually takes mental work, mental exercise to filter in the positive. So by you coming into therapy on a bi-weekly or a monthly basis is not going to be as beneficial as you coming in, seeing a psychoanalytic psychotherapist, coming in weekly and processing that pain. Patients that I've seen in the past that I've worked with on a weekly basis for years have ended up building the insight insofar as now they're able to act in accordance with that insight. Because there are some people who have insight but don't act in accordance with that. So for instance, you may know that your relationship with your father is not the greatest, you have a difficult relationship, and you know that you can project this onto your boss. But in the moment when you are present with your boss, or your boss is giving you maybe not such great evaluation, then all of a sudden the way in which you behave with dad comes out in the dynamic with your boss. Now that's problematic. So you have the insight, but you're not acting from that part of your psyche, and that's a problem. So with psychoanalytic psychotherapy, now you have the opportunity to build that insight and to act in accordance with that insight. So make sure that you're attending your weekly sessions, and if you're not getting the most out of your therapy, question it. Give your therapist feedback, because this is about you. This is your investment in your mental health. So it is your responsibility to ensure you're getting what you need. And if you're not, maybe it's time to move on to a different therapist or a different approach.